intensivist from Connecticut Children's Medical Center, and I am proud to be co-hosting this discussion on physician self-care and wellness from the CHEST organization with Drs. Khan and Dr. C. So we are going to be having a discussion on self-care and wellness, and I will let them introduce themselves.
So I'm Dr. Khan. I work at USC as an intensivist and attending physician, and I've written a lot about physician burnout, and it's a topic that I'm really passionate about, and I'm really excited to be talking to you guys about it today.
I'm Brandon C. I'm a third-year Peds Palm Fellow at University of Florida, and as a fellow, I know I have experienced some of the burnout myself, so I've had to be able to work through it myself, so I'm glad to be able to kind of share some tips that I've picked up along the way as well.
Excellent. So we'll just jump right in. If you have first a few set of ground rules, if you have questions, please go ahead and type them into the chat bar, and we will answer them as well. Khan, so what responsibilities and activities do you enjoy outside of work, and how do you balance them with your job?
Well, a lot of the things that I enjoy kind of focus around my physical health. So I really actually like to go to the gym, and recently I've discovered spin class. And so I go to Soul Cycle classes frequently. And there's a studio right there in downtown LA. So after work, it's really good for me to de-stress. Other things I like to do are, traveling, going to concerts, hanging out with my friends. So I always try to find a way to incorporate some activity that makes me happy and is really fun, at least a few times a week.
I can say, as a devoted follower of your Instagram account, The Female Doc, I'm very jealous of your LA lifestyle.
It is fun. It's a fun lifestyle.
Yeah. How about you, Brandon?
So I try to get in the gym as much as possible. I also am a big fan of the Game of Thrones series, or the Song of Ice and Fire. So a lot of those podcasts and reading the books and stuff like that. So this is a good time of year for that. I also have 2 dogs at home, like to be able to get out and walk them around, take them to the dog parks and do things with them, and just hanging out, doing movies and things with my wife, just trying to kind of keep work and life separated a little bit, to be able to, when I go home, to be able to dedicate time to that. Is kind of more of one of my strategies.
Yeah, that's great. Personally, I have 3 teenagers, and I try to spend as much time with them as I can doing things. I like to spend time outside as well. I'm active in the Boy Scouts and a Scoutmaster for our large troop, which has about 111 scouts. So we do a lot of camping and hiking. So that's the personal side, but I also think professionally it's good to be involved in some of these outside organizations. Being involved in organizations such as CHEST you get a lot of satisfaction out of providing mentorship, developing programs and things. And I think it's really easy for us as clinicians at our own institutions to get bogged down in the problems in that own institution. But when you get out there in the world and see that everybody has pretty much the same problems, the grass is not necessarily greener anywhere else, it helps, I think.
Yeah, I think that's a great point, Chris. Getting involved in some of the national organizations has definitely helped me with my career development, because sometimes you do get bogged down in your own unit, and you start to really focus in on the problems that you're having, and it's nice to be able to connect with colleagues across the nation and sort of vent out your problems or see how they figured out solutions. And I think it's also a good way for people to connect and maybe find a mentor that maybe fits their personality more or has the same interests that they do. For example, like social media is something I'm really into, and there's no one really in my department that's like that. And so it's great to connect with the 2 of you, and that's been really helpful for me.
Well, right back at you. It has been an honor to be involved with both of you guys in social media. Your energy has been spectacular. But I think that's right. Getting out there and seeing, that rings true to me too. Getting out there and seeing other people and connecting and finding our people that don't necessarily have to be in the same building is a good thing.
And as a fellow, I can say that as well. Getting involved with as many as the organizations as possible for me is like the AAP, CHEST, ATS, and it's really more networking and getting to know like what are my options when I get out of fellowship. So I've felt like getting involved with that has been a good thing for me as well. That's how I met both of you guys. Kind of, Chris may not know it, but he's one of my mentors when it comes to social media type stuff as well. So been able to get that experience, which has actually helped me a lot through my fellowship as well.
So do you guys spend a lot of time after work doing charting, paperwork, things like that?
I spend zero time charting and doing paperwork after work. That's a boundary that I have set for myself, and I have the luxury of being an attending, and so my fellows write the notes, and if I can't get to, my little blurb or addendum, it's okay because the important communication has already been documented in the chart. But usually I can prepare for charting. So if I know I'm going to be with a new fellow who's going to be a little bit slower, doesn't know the computer system as much, during rounds, I start writing my notes. And so this way I kind of combat that time crunch. And I rarely end up leaving my notes. And if I do, I know that I can come back the next day and finish off the notes. Now, billing, on the other hand, that I sometimes save for like later, but and I end up playing catch up on billing. But yeah, charting is something I set a boundary, and I don't want to pull out my computer and do that when I get home.
That's really interesting because I think you and I are a minority in that regard. That's a boundary I set for myself too. I don't chart at home. I chart here, and we do our own charting at my institution. The residents and fellows do charting, but the attending has to do their own note. And I don't ever take it home with me. That's a boundary I've never crossed, but very rarely cross. But I think we're in a minority. I think a lot of physicians frequently do spend hours at home charting. I hear from friends and colleagues around the country that they will frequently be charting very late at night.
That's interesting that you say that, because when I was in my sort of private group in Michigan, which was my first job out of fellowship, I was responsible for the notes. Obviously, I didn't have, residents and things. And there were shifts where it was so crazy that I did end up charting at home, and it's miserable to have to finish your notes. And I remember even on my birthday, I think I was up till midnight finishing notes. But I think you start to get a template and you start to get a process. I was a fresh attending, so I was very particular about the way I charted. So, but you get the hang of it, and then you start to figure out what works and what doesn't.
Yeah, I think those of us who aren't as comfortable with records and templates have a lot of trouble.
I completely agree with that. As the fellow who's writing some of the notes, I guess they get sent to Rosie. I do spend probably, especially the weeks that I'm on service and we have consults and we have things going on. If I'm busy throughout the day with bronchoscopies and seeing consults, I do spend a couple of hours probably a night when I'm on call for a week. I may spend 1 to 2 hours doing notes at home, but being able to do my clinic notes in the days of the weeks I'm not on service, using templates basically for, okay, each time the kid comes in, I'll have, I have to put in the subjective part of the note, but I have thing where it pulls in all the lab data, it pulls in PFT data, and I'm able to do my physical exam, my review of systems, and the subjective part, and be able to put my plan in. Most of the time before the kid even leaves the room, I'm able to put in my plan and my assessment, and later is just going back and filling in some of the details. And that actually has helped me a lot to cut down on the amount that I have to do outside of the hospital.
Yeah, I think once you've gotten a little system like that, it really goes a long way. You're reminded of that old cartoon where two guys are pushing a wagon with square wheels, and it says, I have something that might help you, and it's, round wheel, and they're like, no, we're way too busy. Spending some time doing that, I think, can really help. All right, so Rosie, I'll give this one to you. So what tips and tricks have you found helpful in your work-life balance? We talked about one that you had, which was not charting at home.
Yeah. So I wrote an article about the 5 ways that I overcame my burnout, and a lot of it, like I've mentioned before, focused on my physical health, my mental health, and then setting a financial plan in place. I think a lot of the burnout and stress that fresh attendings and fellows probably feel is that burden of your entire student loan debt. And so I think if you're able to write down a financial plan that alleviates some of your stress, and coming up with like a payment plan or however it works in your lifestyle, and then focusing in on finding a job that kind of fits what you're looking for. And I really encourage people to take the time to sort of really do a thorough job hunt and try to find something that works for you, and try to negotiate all the things that you do expect and that you do want in your job. I think that once you've allowed yourself to find a work style that works for you, then you're able to have that time free so that you can focus on the life balance part.
I apologize. I think I was supposed to go first during that one, and I put you on the spot. So I apologize for messing up the order there. So I'll go next, Brandon, and give you a minute. I personally have no tricks or tips. I think it's I think I push back a little bit about work-life balance. I think more I like to talk about work-life integration. Now, maybe that's being semantics, but I think that it's impossible for us to completely put the different parts of our lives into little neatly packaged compartments. Life gets messy, and if I am answering a few emails or many emails at night, I'm also going to, if my teenager calls me in a panic, I'm going to answer the call and going to text them. So I think you really need to find a way to integrate your life with your work in that way. Of course, I'm going to answer a call from my family, and of course, I think will answer those emails. I think we have it fortunate in healthcare because we have a little more flexibility within our work time to answer these demands from home. The average cashier can't stop to answer a text from home or to talk to school, but we have that flexibility because we're in healthcare. I think that there are some limits that you need to put, and I think the charting one is a big limit for me at home. But I will do things at home, but I also won't feel guilty about taking off early to, if I'm not doing anything clinical, to go, coach my daughter's basketball team. So, and there are a lot of other people do similar things, I think.
And that's interesting way you put that too. I guess I never thought of it that way, that specifically being in medicine, like actually having the time to sit down and do something like this in the middle of the day, that, maybe other careers you may not have this kind of opportunity to do things like this, or, and I agree, anytime, during the day something goes on at home with my wife or something like going on, it's rare that I'm so busy that I can't pick up the phone. And I guess that's an advantage when it comes to us. And I think for me, the kind of tips or whatever that I've kind of picked up would be using the spare time that you do have, like kind of finding those times where you kind of have unplanned downtime or even anything like that. My first 2 years of fellowship, I lived about an hour and 15 minutes away from where I work every day. So I had a commute of at least an hour to an hour and a half most days, getting back and forth both ways, going back and forth to home. So I used that time to listen to music, listen to podcasts, get caught up on the news, those kind of things, and using that time kind of in the middle to kind of decompress coming home from work, so that when I got home, it's time to, hang out with my wife, have dinner, do all those kind of things as well. And just finding those times that you may not think, oh, I can't get anything done. You can listen to something from like a chest or ATS podcast, anything like that. You can get caught up on the news. You can relax and listen to some music, and just using the time that you do have is one of the biggest tools that I've come up with.
Yeah, that's a great tip. I find myself getting more stressed out listening to the news. I don't know about you. But...
Well, maybe nowadays, yes.
Yeah.
Yeah, I think, Chris, what you touched on is so great. Like, what really is the definition of work-life balance? And I read a really interesting article recently that was like, work-life balance is expecting not to have work-life balance. And so it's kind of however you feel that you need to define it and what's important to you. So I love work. So that is part of my life. That's like a work-life integration, I guess you could say.
Mm-hmm.
I guess figuring out your priorities and allowing the flexibility for bad days where you just have to take off, or, good days where you want to stay at work longer, and because that's what makes you happy for that day, or you're passionate about that patient case or whatever. And so I think that flexibility in the definition of what is work-life balance is really important.
Yeah, what's that saying? Find a job you love, you'll never work a day in your life.
Yeah.
And it depends on your situation as well, too, because like, especially for me, my wife is a physician as well. We're both fellows at this point. So even going home, some of the conversations we come up with is still kind of centered around medicine sometimes. So it really just depends. There's still that kind of bleed over, but it's interesting because I'm in pulmonology and she's a neurologist. So I get to kind of learn a little bit from her and she learns from me. And it's kind of, it's work bleeding back into life. But, you're right, Chris, there sometimes can't be that huge dividing line in between. You kind of have to have a mesh in between and learn how to balance that.
Yeah, and there's certainly periods in my life where work has been very demanding in terms of not just clinical, but writing grants or papers and other things, and they are demanding. And so, I've not been able to spend as much time at home as I wanted to, but conversely, there's been times where I've had to spend more time at home. And fortunately, we're in a job where a lot of the non-clinical stuff you can put aside and just kick that can down the road if you need to. And I think particularly in pulmonary and critical care, we have a little more flexibility than, say, your general practitioner who's got to see, clinic 5 days a week. All right. So let's see. How do you unwind and manage the stress of patient care and career? Can you provide examples of how you do so in your daily life? I'm supposed to go first for this one again. But we've talked about this a little bit, that I use some of the same strategies that both of you guys use. Do things outside, exercise, do things that don't involve medicine with your friends and your family. Watch Game of Thrones, which I'm also a fan of. Listen to podcasts, which I'm also a fan of, and doing those sort of things. How about you, Brandon?
Sorry. I do the same thing. It's more, there are many things in my life that, are outside of medicine, which I try to make time for. I was a musician before I was a doctor, so I've not done it as much as I want to, but I try to keep involved, listening to different types of music. And now that I'm here in a college town, when I'm actually living in town, I'm hoping to maybe get involved with some choirs and things like that as well. Because, one thing I told myself when I was in medical school was, I'm not just going to become a repository for medical facts and stop being the person that I am. So there's definitely things that, are part of my life that I have to get involved with my church, with my family, with my pets. It's really just work is a big part of it, but it's not the whole part of my life. So I try to make sure I'm enjoying the things I enjoyed before I started medicine. It shouldn't change me as a person, even though I'm, in a different career and have my focus on different things at the moment.
So
How about you,
I
Rosie?
actually have a very specific unwinding strategy when I get home from work. And I have this journal, and I just got it at Target. And it's like a fitness journal, but it's really cool because basically every day you can write down 3 things that you're grateful for. And then like goals to live fit, and what you appreciate about yourself, and what inspires you. And then there's like some blank spots where you can just kind of journal what happened for the day. And so this is something I do when I come home. I just sit down and I try to fill it out. It takes like 5 minutes, and it really helps me. I share a lot about, you know, what I've written on my social media account, on my Instagram, The Female Doc, and Snapchat. And that just kind of helps me forget what just happened because I wrote it down, and then I can move on. And I know studies have shown that journaling actually really helps with burnout and getting those perseverating thoughts out of your head. So
Yeah, there's something about writing something down that really helps. That's so awesome. I love the idea of ritual. You know, doing something routinely that really helps cleanse you. You know, I think we come from different faith backgrounds. Grew up Catholic and went to Catholic college and everything like that. But you know, everything's about the ritual, and there's a lot of reassurance in doing that. And I love the fact that you're able to do that every day. I'm jealous of that. I don't do that at all.
yeah, also writing down the 3 things that you're grateful for, just that simple act, you know, studies have shown that that really helps with combating negative thoughts and promotes a lot of positivity. So I love doing that.
And that kind of crosses over with some of the things I'm sure we've all told medical students to do before when they're rotating with us. Like, okay, write down the 3 things you learned today that you didn't know before, and what do you want to learn tomorrow? And it's kind of using that same practice you use to get where you need to be in medicine. You can use, you know, make sure you're keeping ahead with, you know, life in general as well.
Mm-hmm. So we'll get a little more personal now. Have either of you guys want to talk about any experience you've had with burnout and how you've overcome it?
I can definitely say during residency, and I mean, not so much during fellowship, but during residency, I definitely experienced a good amount of burnout. It kind of came around the same times where I was on inpatient rotations or in the ICU and things as well, where it's just kind of, you know, you're on I was lucky enough to be able to do shift work during my residency. But, you know, just the whole, you know, getting there at 5 a.m. in the morning, leaving around 6 or 7 p.m. after sign out, that it kind of ground on me a lot when I was in my first couple of years of residency. And, you know, really the same kind of things I've been talking about before is for burnout to me is really just when I stop thinking about things that are going on outside of work, and all I'm worrying about is, you know, waking up in the middle of the night wondering, oh, did I forget that order on a patient, or did I forget to write that the right way in my notes? And I think most residents have that same kind of experience. And it's really just kind of trying to take myself out of that. And I wish I was able to do what you guys are able to do and kind of like not do any of the charting or do any of the work outside of work. That's not ever been quite possible for me, but I've kind of been able to pare it down throughout residency and fellowship, and really just remembering that, you know, like I said before, I don't want to just become a repository for medical facts. I'm not just a doctor. I'm also a person as well. And remembering, you know, I was able to luckily live close to my family, my mom, my dad, my brother when I was in residency. So I was able to kind of like go and spend some time with them and get back to, you know, what I was like before I started medicine. It's really what helped me through it. And then also finding a way to organize my time a bit better. It took me until my 3rd year of residency to really learn that I need to write everything down. I'm not going to remember, you know, that medicine on the 2nd out of 12 kids I'm seeing today. I'm not going to remember that medicine I mentioned if I don't write it down and have my little check boxes. And organizing myself and having my own little sign-out sheet that one of my advisors during residency helped me out with. It was something she created in her residency and then gave it to me when I was a resident, so I was able to kind of organize my thoughts a little bit better and really making myself more efficient while I'm at work, and then when I'm outside of work, just having that connection to something outside of medicine was really what helped me through it.
I think you didn't say this explicitly, but I think also forgiving yourself for not being perfect.
Yeah.
None of us are perfect, and we all need tricks and things that will help us through this. And I think realizing what you need is okay, and it doesn't mean you're a bad doctor because you need to write this stuff down. No, it means you're human, and that's kind of what life is like. I think all of us. I've done this for a little longer than you guys have, but there are many people who've done it for way longer than me. I don't know if that low level of burnout ever really goes away. I think it's always there. The compassion fatigue, the the depersonalization that is so easy to get. I think it helps for me to try to connect with the patients, to remember why I went into medicine to begin with. None of us went into medicine to make money. We went into medicine to help people. If we went in to make money, then we were probably foolish because there's a lot better ways to make a living than this. But I think we went in it to help people. So if you kind of see your job as you are trying to help people through this process, then I think it really helps. I get all the time, oh my goodness, I don't know how you can be a pediatric ICU doctor. That's so hard. And my response is, well, yeah, but the kids would still be sick if I weren't here taking care of them. I just wouldn't know about them. I'm here to try to help them and try to help their families through this process. So, I think a reframing of why you are doing what you're doing, and refocusing on your primary reason for why you did this is really key.
Yeah, I actually had a few periods in my training where I felt really burned out, but the worst was probably right after fellowship. I just didn't want to be a physician anymore. And my blog actually kind of started on accident because I went back and started to relearn how to code websites, because that's what I used to do in high school. And so I thought I was just going to completely change my career, but I had to start a job because I had to pay my student loans. So I ended up just negotiating my contract to basically where I said, I'm not going to do nights. I don't have it in me anymore. I'm not going to do 24-hour calls or anything like that. So I got very lucky in that the hospital was very flexible, and they were able to grant me a lot of the things that I negotiated. And then that's kind of where I came up with how I was going to overcome my burnout. I didn't even know about burnout at that time. And I think recognizing or just being aware of burnout is important for physicians as well, because if you don't know, then you can't prepare. So I wrote an article about the 5 ways that I overcame burnout, and that's on my blog at thefemaledoc.com if you guys want to check it out. And but basically,
it's a great blog.
Thank you. Thanks, Chris. So, I invested in my health. I found fun things to do, things like that. And then eventually I started to love medicine again. And then I just kind of melded my new passion of, web development and getting into social media marketing and things like that, and with my medical career. And now I'm at a job that I really love. And so you can overcome your burnout, and just being aware of the challenges that you'll face, especially as a female physician too. I think I did a whole lecture series on my social media accounts about workplace and gender, and kind of the unique things that women will experience that can lead to, more burnout or more stress at work. And just the awareness, I think, is the best thing that a physician can do or have. And that way they're able to prepare with a wellness plan or come up with a strategy to combat, some challenge that they'll face.
I loved that recent hashtag, docs who almost quit. Or doctors who almost quit, I think it was one.
I chimed in on that one as well.
Yeah. I think it, you know, it harps back to that none of us are, we're all human, none of us are perfect. And I think we, as doctors, we really tend to internalize a lot of things and tend to take things very personally when they shouldn't be. But I loved the vulnerability that people were showing with that. That was a great hashtag.
Yeah.
All right, so tips to preventing burnout. We've talked about a lot of them already. Brandon, do you want to give any, or we've covered most of them?
I think I've covered a lot of mine. The things that I would usually do to help myself out. It's really finding those activities you find entertaining. I think one thing for me actually that's helped a lot, I mean, just finding where I kind of fit in. You know, we all are physicians, we all have our patient duties, but there are always different places I think you can fit in medicine as well, when it comes to advocacy, whether it comes to research, whether it comes to, you know, being on social media, like I know all of us are. We're pretty big on advocacy and social media. Finding those little places where you can fit in as well, working in a different, like one of the assemblies or one of the different networks inside of CHEST that we have, just finding that place where you kind of fit in. So it's something, you know, it has to do with medicine, but it's something outside of patient care that you can really get into, and that really kind of helps you to kind of get over some of that fatigue I think we might have. When we were making that comment before, Chris, about that low level of burnout never going away, I'm thinking, oh, we have like a residual volume of stress that kind of never goes away. That was interesting.
Never goes away.
Yeah, I think just having a wellness plan in place that you can just go to is going to be your biggest savior. So, you know, like, I'm going to go to a SoulCycle class today, or, you know, whatever it is that you need to do, just have some plan.
Yeah, and to try to stick to it as much as possible. And it gets harder over the years, but it's key. All right, so a recent article that's linked to shared that soon first-year residents will be asked to work 28-hour shifts. Certainly that's something I had to do. So what advice would you give to these residents?
So I don't know if you guys want me to go first, if I'm the one that's I guess the closest to being a resident. They actually, when I started residency, was when one of the first years that the new kind of rules came into play, where you couldn't work over a certain amount of, I think it was 18 hours as an intern, and then once you got to second year, you could do 24 plus 4, so the 28-hour shifts. So I would say for the residents that are, you know, if they're having to deal with that, one thing they always, the AAP kind of talked about, and we talked about through ACGME as well, is the strategic napping, when you can, like if you have the 15 to 20 minutes where, you know, it's like, okay, you know, I just finished rounding on these kids, I'm going to need to go back and see this patient, you know, in about half an hour, taking those 15 to 20 minutes when you know you're going to feel tired, that kind of area in the afternoon between like 2 and 4, I know is the worst time for me. That's what usually I need a second cup of coffee, or I need to get up and go walk like around the block or something like that outside the hospital to be able to wake myself up. That's one tip I would have for them as well. And then something that helps keep you where you can get that time to where you kind of have those 15 to 20 minutes is, like I was talking about before, finding a way to organize yourself where you can do everything as efficiently as possible. Have your own checkout list. It's not going to be the same thing for everyone, because you think of different things, people's minds work different ways. Finding the organizational system that works for you to be able to get everything done as efficiently as possible, so you have that time to be able to either have a strategic nap, or it's time to just kind of sit down and, you know, read a book or something like that to kind of keep yourself awake going through those shifts, I think would be the best.
Or to connect with your colleagues who are there.
True, very true.
You know, I think that's a key aspect to preventing burnout too, is commiserating with your fellow residents or fellows, or if you're all by yourself, with the nurses. There's always somebody, or pulling out your phone. But there's always somebody there who you can commiserate with, and I think, you know, finding your people is a great way to help during those 28 hours, because it's rarely a sprint for the whole 28 hours. There's always some downtime, like you were saying.
Yeah, I actually trained when the ACGME rule in the state of California was 24 plus 6. So I frequently did 30-hour calls. And it's just something that it's doable. It's miserable, but it's doable. There's a few things though that I think are really important. Like Brandon kind of mentioned, sleeping when you can. Actually, there's a really funny picture of me sleeping on morning rounds. Like I just fell asleep in the chair.
Probably not.
Yeah, that's probably not what you want to fall asleep.
I don't think.
In front of your attending during rounds. But yeah, trying to get sleep in. And I think one of the most important things is actually taking a nap after that 28 hours at the hospital before you drive home.
Yeah.
To me, that is just so important because I've just heard horror stories about
so many car accidents. Yeah.
Car accidents. So one of the best strategies I came up with was I would just nap. And after 30 hours of being in the hospital, I would just go back to the call room and nap. And then typically my nap was like a solid 4 hours because I was dead tired. But this way I could actually drive home and make it home safely.
Right. And you could still have a few hours to have a life before you went to bed that next night.
Exactly. So I would be able to come home and then have dinner or, see my friends or hang out with my parents and do something a little bit more productive. And then just sort of leave that whole sleep tired mess at the hospital.
Yeah.
The other thing I would say is that you're always just going to feel tired. And so you might as well go out and have fun and feel tired. And then the last thing is I didn't do any moonlighting during residency because my free time was so precious to me that there was no amount of money that you could pay me to do extra shifts. I understand that other people don't have that financial freedom. Maybe they have families to support, but I just didn't care about the money. Like I would just buy less stuff,
Yeah.
and I was very, very protective of my free time. And during that
I can tell you daycare is very expensive.
Yeah. If you have
that moonlighting actually was a little less stressful than my job as a fellow at some points, but
yeah. I was fortunate enough to just to not have no children, no husband to take care of. So
I think kind of being tired all the time is just kind of being an adult too. But
yeah.
7 to 9 hours for adults.
All right. So closing thoughts. What do you guys want to say about closing thoughts? We have no particular order for this one, so whoever wants to start.
Thank you guys for joining in on this incredibly important topic. I'm so happy to actually see that the profession in general is just talking about this so much more. I know within the critical care communities, there's now a working group for burnout where, all of the critical care organizations are getting together, and there's a hashtag Stop ICU Burnout that you can follow on social media. And of course, if you want to read any of my articles, they're on thefemaledoc.com, and you can follow me on Instagram at thefemaledoc. But I think just defining what's important to you, defining what work-life balance means to you, and coming up with a wellness plan are, the biggest things that you can do for yourself to maintain your mental and physical health.
And I think the biggest things from my perspective are, like I was saying before, finding the time to do things outside of medicine, those things you enjoyed before you started going to medical school. Don't let it kind of die out. If you have those passions, find time to make those passions come through. Find a local choir group if you're like me to try to get involved with. A lot of people get into board games, reading, those kind of things. I know a lot of us don't do much reading outside of textbooks and journal articles and stuff like that, but finding time for reading for fun and just finding those things that connect you back to who you are outside of being a physician. It's a big part of our lives, but it's not the whole. It's not our whole lives. And what Chris was talking about, getting in there and really talking to your colleagues as well. Your residents are going to be the people if you're a resident, your co-residents that you're around are going to be kind of your closest friends, hopefully, for the years that you're in residency. And really just kind of commiserating with them sometimes is, you know, it is helpful. You guys can kind of work through the same things. You're not the only person going through burnout. So just know that you are not alone out there. All of us have experienced some sort of, some level of it at some point. So, you know, a lot of us, Rosie and Chris, everybody, we're all on Twitter, you know, that we're always, you know, kind of, I try to post funny things most of the time as well, just because I know it's going to be entertaining for people as well. You're going through your Twitter time feed and all you're seeing, you know, is just kind of stuff that's going on in society or anything like that, but they just kind of find these funny things like Gomer Blag and stuff like that that come up. It's really, kind of lifts your spirits a little bit as well. And just finding those things that kind of connect you back to who you were before you went into medicine are really the key things for me.
Yeah, those were great. This has been a fantastic discussion. I think it's very important for us to be kind to ourselves, to be kind to each other, and I think connecting on a human level with our patients and with our you know, our own people that we find. And sometimes it takes a little while to find your people, but they're out there. I'd like to thank you guys for joining us. Thanks for Chest for putting together this discussion on self-care and physician wellness. I think this has been a great discussion, and I hope we can do it again. And thank you guys for very much.
Thanks, Chris. Thanks, Chest.
All right. Thanks, everybody. Have a nice day.